All right. Welcome back. We're going to go ahead and just finish up our seminar today. We'll just go ahead and start a couple minutes early since I think most of our audience is with us. And we are going to hear back from Dr. Danielle Graef, who is a pediatric psychologist at Cincinnati Children's Hospital. She helps children, adolescents, and young adults and families cope with and manage a variety of chronic health conditions. She supports families reaching their personal goals and develop non-medical tools to manage their symptoms. So, Danielle, I will turn it over to you. Thank you for being here.
All right. Hi, everyone. I appreciate the opportunity to be here and share some thoughts and considerations from a mental health standpoint. And so as I'm talking today, some of the things I'll talk about, one is just if some are not familiar with what a pediatric psychologist is or does, I'll briefly introduce that. Mostly what we'll be talking about today are the common challenges that patients and families might have in managing a chronic condition like a neuromuscular disorder, approaches to coping, and then deciding when to seek help further for managing those concerns might be advised. And so as a pediatric psychologist, my job or my interest is being concerned, as talked about at the introduction, the role of physical health in youth and that relationship with the psychological and behavioral factors and managing health and disease. So really it's how the medical and non-medical factors might interact. I've had the opportunity to work with a number of different patients and families across a variety of different neuromuscular disorders, but I still have a lot to learn from all of you and your experiences. And so as I'm talking today, and especially at the end as we're having discussion or questions, I welcome thoughts or questions or experiences that you'd like to share. I know there's a range of different stressors that are faced, how disease management might impact quality of life and coping, and strategies that families have found helpful in managing those stressors. And then I put on here health psychologists because, as we've been talking about just the lifespan of neuromuscular management, from an adult standpoint, health psychologists are similar to pediatric psychologists, but their focus is similar issues, but for individuals who are more on that adult aged end of the spectrum. And disease management can affect family members, whether we're talking about children and parents or even siblings and other caregivers, and it can affect them in different ways. And certainly just like with anything else, what happens to one family member can impact another. And those issues that might come up are also housed within the larger systems that they exist in. So there's extended family members, our school and larger communities. And those systems provide a variety of different challenges or resources from a social, financial, and educational standpoint. And so those are also important to consider. And so that's why we often take a family systems approach in our care to be able to consider all of those things and address all of the needs that patients and families might have. And so the focus on today's talk will be bearing those factors in mind. I'll focus more specifically on patients and caregivers, although certainly siblings are relevant, and I'll mention at the end some resources related to that. In terms of common challenges that families might face, certainly, the pink bubble, there's the just at diagnosis. There's, depending on the family and depending on the diagnosis, there's some unfamiliarity with that. A lot of questions more related to what does this mean? And then the disease often is largely unknown to the broader community. They might think they understand what it means to have a neuromuscular disorder, but they're often less common and they're less understood. And so sometimes for patients or families, there's less supports presence, or there's a lot of work on the individual to really continually explain and educate on the condition and what the specific needs are. And the disease course itself can be variable. That can be between patients. So depending on the diagnosis, even within a diagnosis, there's a broad spectrum of what we might expect to see. And then even within a patient. So over the course of time, what we might see can change, and how that looks for each individual is different. And so certainly that can bring its own challenges in and of itself. And when diagnosed, family at every life is affected, as I mentioned earlier. patients and parents are needing to learn how to manage the chronic condition, but other responsibilities and roles as well, as most of us do. Um, Parents acquire additional roles, so they might serve as the medical caregiver, educational advocates, maybe the home therapist, and maybe they're helping with the home therapies, or they're providing the home nursing supports. And so that can tax time and emotions and finances for some people. And we know, based on research on adjustment, there's a variety of different areas that can be affected when adjusting to a chronic medical condition. One significant aspect, as I mentioned before, is that unpredictable nature of the disease. Some individuals describe grief of loss of health. So this might be, for parents or caregivers, for a child that's maybe not making expected milestones, or for someone who's doing pretty well and they present as healthy on the outside and observably to others as healthy when they're younger. And then as they get older, symptoms might start to present, and then there's some adjustment and coping related to that. And then certainly from a day-to-day standpoint with management, there's medications, the daily exercises, for range of motion or respiratory needs, potential dietary interventions. And then you combine all of that with appointments, managing side effects if there are any, depending on the regimen, and then equipment and home modification needs. And for others, just might be some uncertainty in general. For parents, they might be worried about not just their child's health, but how are they functioning at school? How are they doing with friends and managing the activities that are important to them? All parents want for their child is for them to have full and happy lives, as all parents do, and that's juggling that with all of the aspects of disease as well. And then, from a social standpoint, how to ensure that they're included in activities. In young adults, I know Wendy started to talk about this earlier, just there's questions that come up in terms of managing romantic relationships, how to navigate the normal desire and need for independence in the larger context of need for varied physical needs or support. Caregivers themselves, they spend so much time learning about the condition, as Dr. Kushoff was talking about, researching treatment options or clinical trials, identifying resources for their child, and advocating for them. And as a result of those demands, there might be less time for recreational activities, self-care, and that could further be a barrier to effective stress management. Things on here about, finances, I think the financial stress is self-explanatory, but as we'll talk about today is thinking about practical things in terms of managing those normal and contextual stressors with neuromuscular diseases, and depending on the diagnosis and the specific genetic profile, there is increased risk for a variety of different concerns that we'll discuss in greater detail in a second. And given those greater rates of neurodevelopmental or emotional or behavioral needs combined with the medical, there is a greater need for individualized educational supports as well. So that's where it comes back to the advocacy that I mentioned. So there are a variety of concerns across childhood and adolescence that are common, that are likely to happen for individuals in general, regardless of disease status. But for the patients that we do see with neuromuscular diseases, depending on the diagnosis, they are at increased risk for a number of potential concerns compared to the general population. But I think it's really important to stress that risk does not equate to that they will have this concern. It just means that we want to be aware of those risks and monitor for potential. So our goal is to neither overemphasize or under-recognize or minimize concerns. And with that, thinking about what we might look for. So from an intellectual functioning or learning standpoint, that is not necessarily across the board thing for individuals that might be domain specific and depending on the diagnosis. So for example, with Duchenne, they're more likely to have concerns with reading if they have learning concerns, versus maybe other neuromuscular disorders, it's more the visual, perceptual reasoning and math might be more difficult. Something else that's pretty common that we see in terms of attention and executive functioning concerns, I'll describe what executive functioning means in a little bit. That's pretty common. And in parentheses, you'll see the percentages are referencing what we expect to see in the normal child adolescent population in terms of concerns coming up. So again, concerns might come up, but it's expected. It just perhaps may be more likely that we see these concerns. From an anxiety and mood standpoint, that's another common concern, as well as general behavioral concerns and more obsessive compulsive tendencies. But as I was mentioning before, a lot of our patients are resilient. They're doing well. They either have no concerns, or perhaps if they have some, it's more what we call like subclinical. They have symptoms and that they're relevant, and we want to help them with those things. But we also don't want to overemphasize them either. So when families hear executive functioning, they might ask, what does that mean? It's a larger system. I describe it as might include a combination of our brake pedal, so our stop and think skills. How do we organize ourselves, our self-regulatory system? And within that might include working memory. That's in our brain, how do we keep track of our running to-do list, where are we in completing a larger task? That could even simply be someone's telling you their phone number and you're keeping track of that in your mind as you're trying to write that down or type that down. From self-talk standpoint, we all have that. So that could be something that happens internally. Some of us even do it internally. We're walking through a room and trying to remember what it is that we're doing, or it just helps us to keep track of where we are in the process. And it can also be something that's used when we are trying to stop and think about what the problem is, potential solutions and considerations in selecting a solution. There's regulation of emotion, motivation, and arousal. So with arousal, the other example I give with that is it's like our pressure valve system in our body. We all have one. And how we take in and we regulate the stimuli around us and the accumulation of normal daily stressors, our body naturally relieves that. We may not realize that we do that. And for some individuals, that regulatory system, depending on their diagnosis, may not regulate itself in the same way as typical. And there might need to be external tools or other strategies that can help to relieve that pressure and to help with that regulation. And then I mentioned planning and problem solving earlier. So if concerns are present, there's a number of things that might be observed in terms of how that might present in an individual. That could be just having a hard time with distractibility in tasks or impulse control. So again, that stop and think. Overwhelmed by larger tasks, or maybe they can handle larger tasks if it's something that's part of a daily routine and they've gotten used to that routine. But then when activities are outside of that, that requires those added executive functioning skills in terms of keeping track and trying to figure out how and when and what order to address that routine. And from a language standpoint, for some, it could present as word finding difficulties. Perhaps they're taking longer to answer questions, and they can answer questions. They understand the questions and they have a lot to share. They just need time to process and share that. And also on the flip side, in a situation where perhaps they're emotionally overwhelmed or behaviorally having some challenges, too much verbal at once for some can be overwhelming. And in that case, when we're trying to help them to manage behaviors and emotions, it's talking slower, lower, using fewer words, and that helps to make the situation a little bit less overwhelming. And then other concerns would be endurance in tasks. If something is hard, it's kind of hard to stick with it or to get started in a task. And as I mentioned earlier, there's that general hyperarousal, that regulation system might have some difficulties. And if it does, then that might present in an individual as having an outburst. And that's their way of kind of expressing and letting out that emotion. And then flexibility of thinking is another thing that we might see, that they have a hard time thinking in different ways than that one set way, or maybe thinking of alternative ways to solve problems. One way they tried to solve the problem didn't work, but it's hard to think of other ways to go about it. And so for the most common neuromuscular diseases, there are care guidelines that specifically outline the role of mental health or behavioral medicine providers. And the general recommendation is that to some degree that they're involved with all of the other disciplines. And ideally that would involve some screening of functioning across a number of different domains. So that could be psychosocial and medical management. And then intervening for concerns if they happen to arise. So the goal is to be more proactive even with small, it seems minute challenges, to really develop tools that can help them for if bigger issues arise or to prevent from bigger issues arising. From a neuropsychology evaluation standpoint, Wendy talked about this earlier. Across conditions, this could be something that we would suggest if there's a question in terms of cognitive function, learning problems. Maybe they're not progressing or performing as well in school as we would expect. And with that attention and behavioral regulation, especially if it's affecting their performance, not just in school, but in other areas of their life, being able to understand what their individual strengths and weaknesses are and how can we support them in a way that's specific to them individually with those strengths and weaknesses in mind. For Duchenne and Becker specifically, there's key transition points that we might think about. So if they're diagnosed earlier ages, we might think of things around 5 years of age. That might be catching them before school age. If they're having some emerging concerns, we're catching them early and trying to set them up for success in school. But it even gives a good relative baseline for that individual. So if they're needing reevaluations as they get older, it helps us to understand and know their own individual trajectory over time and how are the supports helping them with thriving and doing well in their lives. And then in terms of just general grades, so third grade is around the time when demands of reading increase. So again, if someone's vulnerable to potential reading difficulties, that might be a time that might present. And then middle school and high school, that's a transition point for everyone, but those are also times when demands on academics, attention, and executive functioning increase a lot. And not only do those demands on executive functioning increase, there's also a general expectation that they can handle those transition points independently. And that's a larger expectation for the population of adolescents in general, but we want to make sure that we're supporting someone within that context. And then in adulthood, that can be a couple of different reasons. That could simply be someone's going off to college and what are their needs beyond the physical in terms of extra time on tests or other needs that we might be able to recommend, knowing those evaluation results. And then as Wendy talked about, helping to guide decisions in terms of shared medical decision-making versus guardianship. Wendy did a beautiful job talking about transition planning earlier, but then there's also just a broader transition discussion in the sense of the transition with independence, those milestones that are really important for any teenager and young adult, and how do we support them in that in the context of their physical needs. And so because we know most are resilient, our approach at Cincinnati Children's, knowing that most are resilient, but there is increased risk, we take more of a prevention-based model of care. So my approach is for a lot of the conditions, universal screening. And what that means is I try to catch everyone at least once, and for sure for certain conditions, once a year and a half, to really continually screen and assess where they are, because that might, again, change over time what their needs are or aren't. And if there are specific concerns that might present as increased risks over time, then we target those concerns and help develop tools and strategies. So these might be symptoms. We're not calling it a disorder, but we want to help them with managing those concerns. And then from a clinical treatment standpoint, these are for, when we traditionally think of working with a psychologist, which is helping them to establish local counseling or psychology supports. And this would be for challenges that persist over time. And when we say something's clinically significant, what we're looking for is something that's frequent or intense in presentation, or functionally it's getting in the way of them thriving in certain areas of their life, and we want to help them with that. But like I mentioned before, we have the patient, but then there's also the challenges that can present for both patients and caregivers. Like other medical conditions that have physical impairments, there's daily functional activities that can be impacted. And so self-care is often done with the help of others, often family members. And with those functional limitations, for some, that might include some one-way dependency, meaning the patient is relying extensively on adult caregivers for some of their activities of daily living or all of their activities of daily living. And thankfully, as medical care has advanced over the years, that also means that the duration of caregiving has increased, and that might impact caregiver mental health. And just depending on the diagnosis and the specific time and medical needs or demands, it depends. And with that, there might be inconsistent access to home health or nursing services. And those are services that might otherwise offset some of those caregiving demands or provide respite. And so if we combine that with the array of behavioral or neurodevelopmental challenges that might present, that can further complicate things as well in terms of overall management. And assuming the role of primary caregiver, regardless of who that family member is and what their strengths are, they are more vulnerable to stress and burden over time. Burnout, I think a lot of us have heard of burnout before in different contexts. It is a multifaceted concept, and this could be something that's experienced by the caregiver, but it can also be experienced by the patient. Um, with burnout, there are different terms like role confusion. So this is just the caregiver is trying to do it all, and they're needing to do it all in some instances, and they're wearing many hats. They're serving as parent, their teacher, their medical caregiver, or all of the above. And burnout occurs when, for an individual, regardless of caregiver or patient, there's little or no control over the situation. Maybe the demands that are placed on them are extensive or time consuming. For caregivers, they sometimes might have unreasonable expectations. Just this feeling of I'm the only one that can manage stretching or transfers. And I put unrealistic in parentheses because I think it's really important, especially with neuromuscular disorders, that sometimes those expectations that caregivers have for themselves is not because they're creating those expectations. It's also something that might be out of necessity, as I mentioned before, in terms of if there aren't additional caregivers or respite supports, they're needing to handle those things, and those expectations are reasonable in that context. With Duchenne specifically, for example, we just have some research looking at caregiver responses or surveys that about 12 to 40% of caregivers endorse frequently or always feeling that they should be doing more for their son. And I think that's true for any parent. They want to be able to do it all and do their best to help their child. And 26 to 69% might endorse feeling stressed with trying to juggle all of the demands of family and work and medical. But despite that, I think the thing I want to emphasize as well, and I think others did in their talks, is that there is evidence that the majority of caregivers are describing a positive and rewarding experience. And so I think, describing the full facet of what our patients and families might experience is really important for us to discuss as well. But when there is that risk for burden or challenges that develop over time, we know that with burnout, that can impact someone's functioning on a variety of different domains, that not just the psychological or emotional end of things, but the larger family system and just individual physical functioning on the caregiver as well. The signs of burnout in general overlap with signs of depression, and they can include changes in mood and behaviors. Many people can feel burnout in their jobs or at other times that things are just exceedingly demanding, probably for a lot of us in the last 6 months in particular. Um, and there's a number of different symptoms. I mentioned kind of more of the traditionally more kind of depressive like things, but even just that feeling of emotional and physical exhaustion. Changes in appetite or weight. With changes in sleep, this is independent of needing to wake up, and if you're helping someone with changing positions in bed, this is independent of that. We're having sleep disruption or other physical things, just getting sick more often. Our immune system reacts to that stress in that way. And so then the question is when do you ride that wave? As we all have periods of time where we have stress or feelings of burnout. And when do you stop and know when it's time to seek help? And for that, there's no perfect time, to be quite honest, to seek help. Often when you're at that point, it's a time where we have the least amount of time to do that, or motivation or ability to do so. But we think about it on the level of how much distress are we experiencing? What is the degree of impairment in terms of how am I functioning in different areas of my life, and how severe are those symptoms? So we all have times where we're just having a day where our mood is low or we're irritable. But when that is present almost like every day, most of the day for long periods of time, that's a different concern. The things that we typically used to enjoy don't cheer us up or bring us that joy, or even just basic self-care tasks. So we're having a hard time making sure that we're eating meals or staying hydrated, for example. And when we have those things present, then that might be a time where we might seek additional help or finding help for ourselves in terms of tools to help with that. So then what can we do? And this is true for patients and caregivers. We know youth with chronic illness do their best when caregivers maintain as much of normal parenting as they can. So that could be as much as feasible, maintaining a normal routine with flexibility, knowing that changes in routine happen, maintaining normal expectations for behavior. Um, and I think a really big one is how can we help to really emphasize areas of mastery and control? In the context of a larger situation where we may not have control, finding those things where we can feel success and confidence and feeling like we do have control is important. And then when we're managing things, considering the fact that everyone has a different way of coping and not every family member is going to do it in the same way, and having that understanding of what each person needs can be helpful. Focusing on relationships. So yes, they're solving problems, but at the core, the relationships are also important and how we support one another. And it's a process. I mean, there's some days where we can think about those long-term goals and the things that we're working on, and then other days where it's one day at a time, and that's okay as well. And so for caregivers, there are days where maybe self-care and the time for that might seem insurmountable. But it is possible, and it is okay to take time for yourself. And I think it's key, actually. So to minimize burnout, that recharging can really help your own personal strength, but then you can funnel that strength to other family members and do your job in a way that you're hoping to do. With that, it could be small things, finding self-care activities or things that help us to relax. If that's reading, sitting outside, going for a walk for 15 minutes, 10 minutes. I mean, on some days, face it, you can find 5 minutes. That precious time can relieve some of that stress, and that's really important. Developing who you are outside of the disease and outside of its management, whether that be who you are as a friend, who you are as a member within your church, if you participate in one, or as a mentor to someone. Letting people help if you're able to, even if they're okay at it, they're not as good at it. Getting that respite is helpful at times. And then with emotion expression, as we talk about for patients, holding it in, that just adds to that pressure valve system I mentioned earlier. And so finding our own personal ways of letting that out and expressing that, whether that be talking about it, journaling about it, or finding an activity that helps to relieve that, can be helpful. And part of self-care too is making those decisions on when professional support helps with the self-care and can enhance your help in terms of other caring for others. And so then on the practical side, and this is true for caregivers or patients, is finding those things that bring physical relaxation. For physical relaxation strategies, or what people describe as like meditation, making it part of just everyday things that helps with just better body awareness. And when we have being a better body detective, however you want to say it, it helps us to monitor and be more aware and manage our stress in a way that feels like we're handling it in a way that we would hope. Distraction, so just things that take our mind off of the larger stressors. But I think it's important too, when we're talking about distraction, we cannot rely on distraction exclusively or one activity exclusively, because it's a fine line between distraction and taking our mind off and avoidance. And the key is trying to figure out where that balance is for you. Taking mini breaks. So if I need to step away for a minute or 5 minutes, and coming back when calmer and less overwhelmed, helps us to face problems and manage situations in a better way or an easier way. Talking ourselves through it, just that self-encouragement of I can get through that, I'm doing the best that I can. And I think too, celebrating successes or changes that are made. So when we're facing emotional or behavioral challenges, or when we're managing physical health, for example, finding not just those big moments, but those small moments and celebrating that because that feels good. And soothing your senses and savoring. It sounds interesting to just say outright, but think about it. Like we find those moments where we might do that, where you think in the wintertime or fall, where we're cozying up in our soft robe or hoodie, savoring, drinking hot chocolate, and just really enjoying that moment and that relaxation that comes with that moment. And those small moments that give us relief and joy, I think, is basically the theme of what we're talking about. And as I mentioned before, too, knowing that it's okay to lean on others for support, just like we also give support. For patients, just the possible strategies that we might talk about. Emotion recognition and regulation. We can't manage things unless we know and can catch the fact that we're feeling that way. And finding a way, as I mentioned for caregivers, a way to express that works for us. Because again, if we hold that in, eventually it's going to come bubbling up. There's the relaxation strategies I mentioned earlier. Planned breaks are a big one. For a lot of activities, even activities we enjoy doing, including video games, if we do them for too long, that adds to that pressure valve system. And if we don't have that time to relieve that, then we can get overwhelmed or easily frustrated. And so it could be a small break just to give our body time to self-regulate, and then we can come back and continue to enjoy that activity or to finish that task that we need to do. General behavior management, I think most of us understand that in terms of how do we shape a child or teen's behaviors in terms of increasing the things we want to see more or decreasing those behaviors we want to see less of. For attention and organization, helping someone develop tools to manage those bigger tasks. How do we break it down into smaller steps so it feels less overwhelming and it gives us that time to self-regulate in between if we need to. Tools to organize ourselves or just make the tasks less overwhelming, like I said. And how do we support the individual, and if they're able to, doing that in a more independent way, I think is important for a lot of individuals. And then if we're talking about non-medical things for managing mood or anxiety, there's the traditional therapies or treatments that we might think of. So pleasant activities, so finding those variety of things that make us feel good, bring us joy. If someone has specific fears or situations, it's how do we help them with gradually facing those things in a way where they can increase confidence and decrease discomfort when they're faced with those situations. And then just broader in terms of thoughts, catching and managing thoughts that can be challenging. They might come with the big emotions. They might keep the big emotions going. And if we can manage those thoughts in a different way, maybe we'll feel a different way. Helping manage the medical regimen. So someone's thriving and doing well from a general psychosocial standpoint, there's a lot that is asked of us when we're managing a chronic illness. And so simply could be problem solving and goal setting, just having that person to bounce ideas off of, and just kind of that coaching, that self-management. For younger kids, that could be helping parents with finding incentives or ways to encourage kids to make that choice to engage in that behavior or task, even if they don't always want to. And then for older individuals, it's what are their own reasons for engaging in that task? Why is it important to them? What do they get from that task that's important to them personally? And just on some days we're tired, and so how do we convince ourselves to do something that we don't always want to do? And then with if someone is on respiratory supports like BiPAP, then it's not a natural thing to get used to. So it's how do we help someone to get acclimated in a gradual way that's individual to them so they can feel confident and tolerating it and doing it as regularly as they need to be doing. Larger disease coping, just adjustment to the diagnosis, management, disclosure. So that could be deciding if, when, and how we want to share with others or respond to others' questions regarding our disease or if we're in a wheelchair. Coping with declines in function and mobility. And then after graduation, there's normal challenges in transition for everyone. There's not that structure in terms of activities and friendships where that makes it easier for us to have those activities. And so then it's navigating those challenges that all of us experience after high school. Self-advocacy, transition, you're noticing a theme, just independence promotion. And then For those who have more significant concerns, we provide supports and strategies in terms of figuring out local supports in terms of who those people might be. And with the goal being that they can help improve their symptoms, managing their quality of life and family functioning. For medical visits or other providers, families and patients might hear the word cognitive behavioral therapy, or CBT is the abbreviation. That's a type of treatment that is a treatment approach that's used for a variety of different concerns. It involves supporting, problem solving, teaching just active coping strategies to change unhealthy behaviors or attitudes that might contribute to emotional distress. But with that, it's also considering that larger context in terms of the role of medication in that emotional distress or whatever the symptoms are, and the role of social support in other situations that might affect us as well. But there are other approaches to managing challenges and emotions and everything in between. There's a quote a colleague shared with me that I think is relevant to all of us as human beings. And that quote is, you can't do anything about the length of your life, but you can do something about its width and its depth. So beyond CBT, that involves changing beliefs and controlling distress, and that can be helpful. But there's also other types of treatments. And for individuals with muscle diseases that are often progressive, that involve functional impairment, the negative thoughts about illness and self in the future are normal. It's a natural response to challenges that come up. And so we may not necessarily be challenged in that because that's a normal experience. And so, but on the other hand, with a chronic illness, that can take over. It can get in the way of us enjoying our life and moving forward, or feeling like we're moving forward. And so other kinds of treatments or approaches focus on being present focused, so not too much past and not too much future focus, but still acknowledging those things, and willingness to experience difficult thoughts and feelings, and focusing on meaningful activities that, despite the face of challenging circumstances, that we're focusing on those activities. So it's really flexibly pursuing our behaviors that or situations or activities that are in line with deeply held values. So we call that valued living. And so values are different than family values. This is really for each individual what their heart and mind says is important to them, what brings them meaning, what brings them joy. So it's the direction that you move despite any uncertainty, despite any challenges. And that's different than goal. And I think that's important to emphasize. You know, goals would be, you know, I want to graduate high school, or I want to have a job, or different things with their relationships with others. These are themes of things that are important to us that might include goals within that. So for example, this could be being of service to others, seeking knowledge, curiosity, creativity, and then just loving others and being loved. So those are just a few examples, but those are our broad values, and how we engage in activities that are consistent with those values. Any step, any point in that direction, that counts in terms of us moving towards our values. And when we do that, we feel like we have a life of purpose. It enhances our quality of living. And so these are unique to all of us, and this can change over time. So what's of value to us right now might change over time, and that's okay. And we help individuals figure out what those are and how can we help them to focus on that values living. And so hopefully in the talks today, including mine, in our work with families in clinic, over the course of your long journey of life, we aspire to really communicate a message of hope, support, and then, as I mentioned before, just the valued living. And hopefully we did that over the course of today's talks. In terms of resources based off of my talk, NDA has some wonderful resources for caregivers. I mean, there's a lot. Just the couple I put here. There's some articles that are specific to parents as caregivers of those with neuromuscular disorders, and then also sibling adult caregivers of those of neuromuscular disorders. Resources related to caregiver burnout. And I know I did not talk about siblings today in great detail, but siblingsupport.org is a great resource for just thinking about what are those issues and considerations for siblings of those with any chronic illness. And then if someone needs more regular supports in terms of therapy services, that can be found through the Ohio Psychological Association. They have on their website a way, similar to like what Dr. Kusloff said, you can filter by specific area of the state. What are your concerns that you want them to help treat with, and age? And then if you're outside of Ohio, psychologytoday.com is another one, which again, you can filter out in terms of presenting concerns or age group. And then you get a profile in terms of the description of the person and the kind of treatment they provide to see if that would be a good fit for you personally. All right, so I thank everyone for their time, and I welcome any questions or discussion points regarding what we talked about today.
Thank you, Danielle. We did get something typed in regards to just having the prognosis of a neuromuscular disease, handling the stress and the anxiety of knowing, what that child or patient's, lifespan is going to be like is rather intimidating. And is there any advice to coping with, living with a neuromuscular disorder and the stress it brings?
Yeah, for sure. So I think that's a big question and an important one. I think there's no one right way to go about it. I think at the core, and I think some of the others got at this earlier, is it's important that the questions are going to naturally come up, and especially as symptoms evolve over time, there's going to be those questions, especially in an online world. They're going to start trying to research things on their own, which we try to say it's a big no-no. Go to good resources in terms of your individual physician and your treatment team. But not shying away from the conversations. That's the first thing. So validating that perspective, answering questions in a developmentally appropriate way. I think with that too is managing expectations. So again, online it's not necessarily up to date or correct information. So then it's encouraging them to have questions and discussions. And like Wendy was talking about, they have those questions and come to their medical visits if they're not sure, and we can have that conversation as a team. But then also too, it is acknowledging that there is that question in terms of overall lifespan and how do we help them to cope with that. And I think it's such a fine balance. We want to validate that perspective and acknowledge that difficulty. But at the same time, we don't want them to be so future focused that they're missing out on the now and that they're not pursuing things that are important to them. And as the others talked about, I mean, with all of the treatments going on now and the trials, our patients, our young men are living much longer and they're achieving things that are really great. And we want to help our patients to really focus on that. What is important to them and what do they want to achieve in their life? So when I mentioned the values earlier, it's not just the lifespan, it's we're talking about our width and our depth. And can we have it be the focus discussion? And it's not that that's not important and we don't want to invalidate that, but we don't want to get stuck in that either.
Exactly. And I feel like too, that's very relevant to this whole COVID pandemic. I think everybody is living in different, regions of the area that's listening today. And I think that that's been very stressful on our families just because they don't know if they should take their child or take their loved one to the grocery, or should they, take them to the store now that school's starting. There's a lot of stress around COVID right now. And so not just to talk kind of about the elephant in the room, but I think that's been a huge stress for people. And I think that having them have an outlet for that is important.
For sure. And I think specific to COVID, we're having these open discussions. It's very individual and family specific and probably condition specific. And so similar to the lifespan question in larger conversation is bringing those questions to your healthcare providers, to your treatment team, and they can help you figure out what's best for you as a family and an individual. And there's no one right choice. And I think that's part of the discomfort.
Exactly. Well, thank you so much. I appreciate your time today. It was a great presentation, and enjoy the rest of your day.
Thank you.
Well, this concludes our seminar for today. So thank you all for joining us. I want to thank all the presenters for their time as well. And again, I want to thank our supporters, Biogen, Genentech, and Numotion Foundation. And if you have questions after this seminar or about any other Engage programs, please feel free to email me at mdaengage@mdausa.org. I will be emailing a brief survey afterwards. If I could get your thoughts on the seminar, we would greatly appreciate your feedback. And then thank you all for joining us, and we look forward to seeing you at future Engage events. So have a great rest of your Saturday.